Hey guys, this is Naman Rao. I hope you're doing well and keeping safe. Today we're going to prep tooth number 30, MO, and I'm going to show in this video how easily you can do class 2. It's not a big deal, it's really very easy. The first step is use a 330 burr and go to a depth of 1.5 mm and make all the depth cuts along the grooves. That's the most easiest thing that you can do. This I call it as mapping. The next step is measure it. I always use the funda of measure it twice and cut it once. If you have used the burr 330 as I mentioned earlier, and if you have gone the entire length of the cutting surface of the burr, then you are easily 1.5 mm to 1.6 mm deep inside. The next step is very easy. Connect the dots and follow the cuspal outline. Doing so will give you a really nice shape to your prep. Once we have achieved the primary shape, we will measure the remaining marginal ridge, which should be 2 mm for the molar on the distal side, and since this is MO, you're going to make a box on the mesial side. Now as you can see, I'm taking the burr more towards the mesial side, and I'm also being very mindful that I'm not going and breaking entirely the mesial marginal ridge. I always try to keep a leaf of thin enamel or ivory so that you don't nick the adjacent tooth. Always remember, nicking the adjacent tooth is a big failure, be it on exam or be it on patient. Now as you can see, I'm being very careful and I'm trying to create a box on the mesial side without opening the margin. As you can see, we have now achieved some primary box shape on the mesial side, and now we're going to extend more towards buccal and the lingual surface. You can still see there is a thin ivory between the first molar and premolar on the mesial side. The reason being is we don't want to nick the adjacent tooth. Now as you can see, we are close enough with the box preparation. We will break the contact using a hand instrument. Once we open up the contact, we will get to know if we have to further take our box down or not. Once you break the contact, the next step is use a barrier. As you can see, we have placed the barrier. The next step is go further down on the mesial side of this box and try to open up the contact area. As we move forward towards the finishing step, I try to use burr 850-012. You don't have to remember the name of the burr. I'll put this in the description and also on the screen. I use this burr to make the proper line angle and point angle of the prep, and sometimes using burr 229 and 330 can be challenging for the beginners, so I personally prefer using 850-012 burr. Also, as we go further, try to use hand instruments to smoothen the surface and to make sure that everything is even in your prep. There should not be any unsupported enamel or ivory in this case. Also make sure that your axiopulpal line angle should be very rounded and smooth. And this can be achieved using burr 850-012 with slow speed. As we can see, I'm using burr 330 again, and now I'm using it with a very slow speed, and I'm trying to make the entire floor even. A lot of time this happens with everyone, that your floor is slanted and tilted, and it's always more tilted towards the buccal and less towards the lingual. I don't know the reason why, but just make sure you smoothen it and you make it even. Use the Explorer and run over the entire prep, and there should not be any catch and there should not be any rough surface in your prep. If there's a rough surface, use the slow speed again and use over that surface and you will get the best outcome. Measure the prep again and see if you were able to achieve in the range of 1.5 to 2 mm depth. Also check if you were able to open the contact on the proximal side where you were preparing the box. The most important thing which people miss. If you miss this step, if you don't open the contact, it's a big failure. And as you can see, we were able to achieve that, so we are in good shape. So guys, Class II prep is really easy. Don't complicate it. It's really simple. Follow only 5 important steps for all the exam. 1. The depth and width of the prep. The depth is 1.5 mm to 2 mm and the width is 1/3 of the intercuspal width. Second, most important, open the contact area by at least 0.5 mm. Third, no sharp line angles, especially make sure your axiopulpal line angle is beveled or rounded and smoothened. 4. Floor and wall should be even and smooth. And 5th, most important, no nicking of the adjacent tip. So if you follow these steps, you should be good to go. Thanks a lot for watching this video, and if you like this video, please share it with your colleagues so that we can help more people. Thanks a lot. Have a nice day.